Hi, I'm Dr. Richards, the Associate Program Director at the University of Chicago, and welcome to our virtual tour.
We are located in Hyde Park, a neighborhood in the south side of Chicago. This is where our residents and fellows spend most of our time. The campus is made up of 4 different hospitals: the Center for Care and Discovery, DCAM, Comer Children's Hospital, and Mitchell Hospital. Our 4 hospitals are connected by bridges and tunnels so that we don't have to go outside in the middle of the winter. But on a nice day, we like to walk outside. Let's start here, in an ultrasound suite. As residents, we often pop in and out of the reading room to ask questions and learn more about ultrasound. Many of our off-site locations also have ultrasound departments that we rotate through. We are now going to make our way through the ultrasound department to see the rest of DCAM. This is DCAM, our main outpatient building. This is where our outpatient operating rooms are located, as well as the majority of our clinics and procedure rooms. Our clinics are equipped with all of the gynecologic supplies needed for procedures. One of our clinics is the Ryan Center for Family Planning. This is where we perform abortions and provide contraception to patients. Aside from the cafeteria, we have a lot of other great options to grab snacks on the way to labor and delivery.
Comer Children's Hospital is our state-of-the-art children's hospital here at the University of Chicago that delivers expert pediatric care. It is also the home of our Family Birth Center, aka Labor and Delivery. Comer houses inpatient units, pediatric clinics, and a pediatric emergency department, which is also a trauma center. We have 2 pediatric adolescent gynecologists who see patients and perform surgery in Comer. The Family Birth Center is equipped with 9 private delivery rooms, 2 of which have tubs. We have 5 acute antepartum rooms and 2 state-of-the-art operating rooms. Additionally, we have antepartum rooms and postpartum rooms in the Mitchell Hospital. Our multidisciplinary workroom in the Family Birth Center includes attendings, residents, fellows, students, certified nurse midwives, APPs, and our OB anesthesia team. It makes for a very close-knit community to ensure excellent interdisciplinary care is provided to every patient. And here, in our OB emergency room, we can provide expedited care to our pregnant patients greater than 20 weeks on the unit. We deliver almost 3,000 babies annually, including operative vaginal deliveries. And we are also a referral center for high-risk pregnancies from Illinois and Indiana.
Here we are in the Center for Care and Discovery, also called the CCD. This is the building where the majority of our gynecology and subspecialty training takes place. This building also has the adult emergency room, which is a level 1 trauma center. That means that during your residency, you'll participate in obstetric and gynecologic trauma care. This building has 300 hospital beds, 50 ICU beds, and 31 operating rooms. Also, every resident gets a meal card that can be used at the cafeteria in this building and throughout campus. Here on the 8th floor of the CCD, we have our gynecology workroom, which is where the different gyne subspecialties get their work done during the day. Our team always includes residents, medical students, and our APPs, or advanced practice practitioners. We also work with fellows from the different subspecialties, including minimally invasive gyne surgery, urogynecology, GYN-ONC, and family planning. On the 6th floor of the CCD are where our main operating rooms are. And these ORs are where all of our inpatient gynecology procedures happen, including our robotic cases. Also, in another building on campus, Mitchell Building, is where a simulation center is, where you can practice your robotic and laparoscopic skills.
We've made our way over to the administrative side of the hospital. During residency, we spend some of our time in the department on Friday mornings during didactics and for grand rounds. Also, some of the people that help support us behind the scenes have their offices located here too, in addition to all of the attending. So if you need to catch up with anyone, you know where to find them.
Welcome to Endeavor Health NorthShore Hospitals. This is where about 30% of our residency is. The main hospital is located here in Evanston, Illinois, just north of the city of Chicago along the lake. This is a high-volume, academic-affiliated community hospital. However, we're also extremely lucky to have every subspecialty here as well.
Our gynecology team covers MIGS, Urogyn, GYN-ONC, and emergency cases, and we cover all sorts of approaches, including laparoscopic, robotic, and open cases.
I'm Dr. 𝗔𝗂𝘂𝗖𝗂𝗍, the site director for the OB/GYN Residency Program. Here, we are at Evanston Hospital's Granger Center for Simulation and Innovation, where residents are able to practice their laparoscopic and robotic skills.
From an obstetric standpoint, we get a lot of vaginal deliveries, operative vaginal deliveries, and C-sections. Now we're across the street from the main hospital in the Community Health Center, where the residents have continuity clinic. Depending on what rotation you're on, you're typically here 1/2 day a week. We have a range of clinic visits here, from low-risk OB to annuals to complicated GYN patients to procedure visits. With an attending supervisor, we have the autonomy to create plans for our patients with supervision when needed.
I'm Dr. Simon, Program Director for the OB/GYN Residency. Thank you for joining us on our virtual tour today. Bye-bye.